controlling it from there. So. We're live.
Yes, all right. Welcome everyone to our Palm Coast virtual town hall. Thank you so much for joining us. We have a few hundred people that have registered today with lots of unbelievably amazing questions that are important to stay informed and up to date as we work our way through a global pandemic that obviously is impacting all of us. We wanted to start off with a new initiative that we think will be helpful through these trying times. It's a way for our residents to remain connected within their city and all of the great amenities and great programs that they have at their disposal that they can watch right from the comfort of their own living room. So we're going to play you a brief video, and then we'll do introductions of those that are participating in the town hall today. Mayor Melissa Holland here. I know times are stressful right now as we all face uncertain circumstances from the impact of COVID-19. And I know our routines and hobbies have been disrupted by the closures and cancellations. And I am extremely grateful to everyone for doing their part by staying at home and practicing social distancing. That's why today I am excited to announce the launch of the Mayor's Rise Up Palm Coast initiative. It's a citywide effort to connect our community in never-before-seen ways through these unprecedented times. We're partnering with organizations and representatives throughout Palm Coast to deliver dynamic, engaging content to help you live a healthy, fulfilling life in even the most challenging of times. You'll be able to learn about cooking healthy meals, exercising at home, discover family activities, enjoy the arts, performances, and so much more. We are building an ecosystem of engagement for you, our residents, and you will be able to view it all on the Palm Coast Parks and Recreation Facebook page from the comfort and safety of your own home. Palm Coast remains a beautiful, vibrant community with endless entertainment and recreation options. I look forward to sharing that with all of you over the coming weeks. For now, I want to turn it over to my friends around the city. Let's rise up Palm Coast.
Hello, Palm Coast! City Manager Matt Morton here. Your city is still here for you. Most of us are working remotely, and those who aren't are maintaining clean work environments. We're mobilizing our resources to those most in need in our community and maintaining our beautiful city by completing essential projects. We're collecting data and we're analyzing it to make better informed decisions as we navigate these unfamiliar times. We're stepping up to serve you in new ways, and now we're asking for one thing in return. Rise up, Palm Coast. Let's get everyone engaged, and remember, no one is in this fight alone. We're here for you.
.97.6. This is Jerry Forte, Chief of the Palm Coast Fire Department, reminding everybody about the new normal. Try to isolate, try to keep away from people. That's what we're doing with our fire crews.
Our firefighters have made some changes responding to calls, both for our protection and yours. Be rest assured, when you call, our firefighters will be responding as you need us.
Hey Palm Coast, it's Lauren Johnston, Parks and Recreation Director. I'm home, and I hope you are too, but if you're an essential employee, I know it's important for you to be going to work, and I want to thank all of those essential employees. While all of our parks, trails, and lovely facilities are closed, we're offering virtual recreation programming so you can recreation at home. See you later.
Despite City Hall being closed to the public, almost our entire team is working remote.
Things like permitting and other city business can be done online.
The Finance Department is still managing billing, accounting, procurement, and monitoring the budget amongst all our other functions. The majority of these are all happening remotely.
Our customer service team has been busy working from home. They're your friends, your neighbors, and they're there taking calls, answering questions, and utility service questions, and also managing our Palm Coast Connect cases.
All city employees are essential, working hard to make sure services are still provided to residents. Services like utilities, including water and sewer.
You'll see our stormwater and engineering crews working on pipe and swale projects like this one here behind me. These are vital to our stormwater infrastructure in preparation for the upcoming storm season.
And our public works employees are hard at work, making sure that the streets, facilities, and the city's vehicles are in tip-top shape.
Together, your city workforce is able to accomplish services out in the field or remote. In IT, we've been prepared for this major technology shift.
Our goal is to get through this as best we can. We're in this together, we're in this with you, so let's rise up, Palm Coast.
Hi, this is Bob Snyder, Health Officer for the Health Department here in Flagler County. Just want to provide a shout out of encouragement for the Mayor's inspirational Rise Up Palm Coast initiative to face this coronavirus head on. You know, this is a way to establish new routines and provide tips and guidelines for that. And we also appreciate the wonderful partnership between us and the city. The virtual town hall every Wednesdays, the radio show in the mornings on 94.9 FM, all have been wonderful ways to keep our community informed. Hang strong, everyone. Palm Coast, Flagler County, together we're going to beat this.
Hi everyone, Flagler School Superintendent Jim Tager here. One of the things that make our educators so special is their ability to inspire. We began the 2019-2020 school year just like any other school year. We had a scare from Hurricane Dorian, which forced us to lose a week of school, but we were able to rise up above the challenge. But who knew what was in store for us 6 months later? We are ending with yearbook highlights like we've never seen before. Virtual parades, virtual PE, virtual announcements, and our employees have stepped away from their campuses to provide meals to our families. Technology has allowed us to transform instruction by connecting students, even a chorus, together from home. I realize we've been fortunate to have technology to help keep us connected, but we still face the challenge of being connected on a very human level. We crave that person-to-person connection, live and in person, not through a bunch of pixels that string together to bring a picture over a screen. And that will come back when it's safe for us to all be back together. Until that time comes, it's great to see so many of you, our teachers, students, and support staff continue to reach out and bring some sense of normalcy in these most unnormal times we've ever been through. Keep learning, keep reaching out. We will rise up from this and be a stronger community.
Hello, Palm Coast. This is Sheriff Rick Staley. For weeks, the Sheriff's Office has been educating residents on the emergency orders and changes caused by this pandemic. While the schools are closed, our school resource deputies are connecting with students through a social media reading series and helping the school district distribute meals. We now have a virtual neighborhood watch where you can learn what is going on in your neighborhood. We've also tried to bring some fun and memorable moments to you. Recently, 2 little girls missed out on having their birthday parties. So we had a few deputies make a special stop in their neighborhood. If you had to cancel a celebration for your child, call our non-emergency number at 313-4911. And if we are not busy, a deputy will try to stop by and help you celebrate. Follow us on social media or download the FCSO app at the Apple Store or Google Play. You can also follow us at flaglersheriff.com/coronavirus. Remember, Palm Coast, with everyone working together, we will get through this.
Hello everyone, Wally Diaquino here from Advent Health Palm Coast. In a recent event, many of you from our community drove to our hospital, pumped your horns, flashed your lights to show support to our staff. That had a great impact on our team. Others have donated food, masks, thank you cards, even Girl Scout cookies, and that is uplifting and making a difference. I want to let you know that we will stay committed to our staff, first responders, and our community. We're thankful to be able to serve this community.
Hi everyone, this is Pastor Greg Peters with Parkview Church. I know that you'll agree with me that we find ourselves in some unprecedented times, but we will not let COVID-19 get the best of us. As a community and as a nation, we will continue to rise up and navigate these uncharted waters. Let me encourage you during this time to continue to follow all recommended guidelines. In fact, make sure that while you're socially distancing, that you're still relationally connecting and spiritually growing. We're not out of the woods yet, and there's still some time ahead of us, but I'm thankful that during this opportunity that we have to virtually connect, even in this video, I'm also reminded of the great leadership of our city and how they have provided virtual meetings and repeated connections through their platforms so that we can be informed citizens. To my friends here in Palm Coast, a new day is on the horizon, so let us rise up and face the opportunities that are ahead of us.
We're really excited to see what you all think of Rise Up Palm Coast. Ultimately, this is for the community, provided by the community. If you have any type of feedback, please feel free to send us a message on Facebook or send me an email. If you have any type of programs or ideas that you want to see added to our programming schedule, we'd be happy to hear it. So thank you all for your support, and let's rise up, Palm Coast.
So hopefully everyone will be participating again. All the great programming that our Parks and Rec team have been working hard on to provide for you. So check it out and make sure you stay informed and connected. I'm now going to introduce our guests that are calling remotely today, but those that are here at your City Hall. We have our City Manager, Matt Morton, who is leading the charge from the city organization perspective and managing the best he can through this crisis. We have Bob Snyder, our health officer for the health department in Flagler County, that frankly has been not only on the front lines, but he and his team have done an extraordinary job through the most challenging of times. And then on the phone today, we have three guests. One is our medical director, Dr. Stephen Bickle, who again has been a wealth of knowledge and information, has helped us make sound decisions on behalf of our residents to keep them safe, and again continues to keep us informed. We also have Wally D'Inquino, the COO of Advent Health Hospital System that is located right here in our community. They're a great community partner, and they've been doing their best to not only help our residents get through this, keep our residents safe, but they also have a great responsibility with all their healthcare workers that have been on the front line throughout this. And then we have joining us today, because we receive so many questions around testing on a continual basis. Our residents really want to understand the process of testing, how it's working, how we've now moved to a next step to offer more testing for our residents. And we've been able to do that because we have a local company that stepped up in an extraordinary way. Tony Hoffman from Diagnostics Solutions Laboratory has worked with our stakeholders and partners, not only with the health department, not only with the hospital, with the county emergency management team, but it's been an extraordinary effort by many people to get us to this point. So you'll hear a little bit more from Tony as well. So I wanted to give the opportunity to our stakeholders and our partner just to provide an update first before we open it up with the questions that have been received today and weeks past. So first I'm going to ask Bob if you'll give the health department update.
Thank you, Mayor. I'd like to share some data highlights. So as of this morning, total positive cases statewide is 22,081. Deaths number 591. Total folks tested 211,244. In Flagler County, total positives are 45. 36 of those are from Palm Coast residents who are quarantined at home. 3 from Bunnell, and 3 from Flagler Beach. Total lab tests in the county, 793, with a positive rate of 6%, which is below the state average of 10%. Compared to last Wednesday, Flagler County residents tested has increased by 69%. Positive cases are up 28%. Total deaths in Flagler is 2. Hospitalizations to date is 7. But this week, the big news for Flagler County and Palm Coast residents is the increase in testing sites for both healthcare workers, first responders, and persons with clinical symptoms for the virus. Advent Health opened a community testing site at the International Speedway last Friday. Advent Health Centric Care in Ormond Beach is providing free testing for healthcare workers and first responders. But closer to home, County Emergency Management partnered with the Department of Health, EMS and paramedics, Advent Health Palm Coast, the hospital, Flagler Volunteer Services, law enforcement, the City of Palm Coast, Daytona State College, Diagnostic Solutions, our local laboratory, medical and nursing students, and CERT team volunteers to open up the very first Flagler County testing site at the Daytona State College Palm Coast campus. Yesterday, tests were offered to first responders there and healthcare workers at no cost. But starting today, testing by appointment begins in Palm Coast on the campus from 9 a.m. till 1 p.m., and it will continue tomorrow. It is quite the operation involving up to 40 medical, safety, and county super caregivers and responders. This Palm Coast community testing site will continue until supplies like nasal and throat swabs, specimen collection tubes, and PPE garb last. Testing priorities are Flagler County residents with clinical symptoms, the elderly with underlying conditions, and persons with symptoms who are immunocompromised. Please call the following number for an appointment: 386-313-4200. And you can call from 8 a.m. to 5 p.m. Monday through Friday to complete a pre-screening process and be given an appointment for the drive-through site. It takes 10 to 15 minutes for the test by nasal swab. Everyday testing is still being done by the health department, hospital, the urgent care centers in Flagler County, Asa Health on the Parkway, and Centric Care facilities. So the big news is testing. It's really improved, and it has increased Mayor Melissa, Holland, and Matt in our community. So we're very grateful.
That's great. Thank you for that update. Wally, if you could provide an update on behalf of Advent Health, where are you at? What's going on? It would be helpful for our residents to hear right from you.
Thank you, Mayor Melissa. At Advent Health, we have made significant investments in services and infrastructure, and we continue to work with personnel in doing trainings to make sure that there's cross training across our departments to make sure that if we have a surge, we'll be able to capitalize on all of our employees focusing on the areas that need most help. We have finished our emergency management protocols. We got it all in place. We continue to work daily with our command centers. We have one locally here at Advent Health Palm Coast. We work with daily with our command center at a division level, which is located in Orlando, which is extremely beneficial for us. Being a large company, they help us with a lot of the supplies and equipment needs. And we also work on a weekly basis with our corporate command center to make sure that everything that we need is flowing through and all the information required for us to make our decisions. We have taken the measures to ensure the safety of our patients, our Advent Health family, and our greater community. Lately, our focus this week especially has been to support the initiatives for our county emergency management drive-through testing. And we're working also to provide more testing for this initiative to make sure that our residents and first responders continue to have testing available in the following days to come.
Thank you so much for that important update, Wally. So Tony, if you could give an introduction of yourself and a little bit about the relationships that have been formed and where you are in the process and the understanding of testing.
Sure. So about almost 2 weeks ago now, my name is Tony Hoffman. I'm the co-founder and CEO of Diagnostic Solutions Laboratory. The laboratory is located in Alpharetta, Georgia, which is just outside of Atlanta. However, the corporate headquarters and business offices are located here in Palm Coast. So as a community member, we were able to get in touch with the mayor and the teams for the county emergency management, public health, and start working on the process. We were able to offer testing services and to the county and city. And last 2 weeks, we've worked hard to get it up and running. And as yesterday, as mentioned before by Bob, that first set of samples were taken. They arrived this morning at our laboratory, and those samples will be turned out sometime this afternoon. One of the major things that Diagnostic Solutions Lab does in the process for COVID-19 testing is limit the numbers of accounts that we actually contract with so that we can maintain this turnaround time that is so vitally necessary in managing patients. So we're happy to have the capacity to bring Palm Coast and the county and other accounts here locally in our community online and offer our services.
Well, we really thank you for that, and thank you for reaching out and not only showing your commitment to our community, but in the middle of a pandemic and a global crisis, I really cannot show enough gratitude for your leadership. So we're going to now move to the questions that have come in from our residents. Not a surprise, a lot of it has to do with testing, but there are others that I'm going to pose to the different panelists up here and those that are on the phone. The first question is the governor going to tell each county when they can open based on infection rate, or is it going to be left open to each mayor of each city? Do you have a meeting date set up where all the mayors and governor are going to get together and come up with a plan? As many of you may know, we signed an executive order, and we actually executed a proclamation very early on in an effort to ask our residents to please stay home. It's, I think, been effective and has been helpful throughout this process. However, in the interim, the governor had signed an executive order that really dealt and addressed with businesses and those sorts of things and different requirements and restrictions that we had to comply with as a local community. I will say that, there are morning calls every single morning with each and every one of the stakeholders that I mentioned earlier. And I know that the Florida Department of Emergency Management is in contact daily with our Flagler County Department of Emergency Management, and they're really talking about where we are with the rates. And I think the thought is going to be that the governor is also going to look at when lifting these restrictions is appropriate for the health and safety and welfare of our communities. And he is actively communicating with our local officials in an effort to understand what our needs are, some of our challenges, some of the issues that our residents have posed to us. So you will be the first to know when we do make adjustments, when that's allowable. I will say we really do rely heavily on our partners in the health department that frankly are the professionals in this regard. No better team than I've seen than Dr. Bickle and Bob Snyder that really do understand the stresses and the anxiety that this has caused our residents, the economic hardships that this has presented and posed, but their priority is going to be the health and safety and welfare of our community first and foremost. That is their responsibility. Our responsibility is to heed the warnings from the health professionals and to get things up and running as quickly as possible. So a lengthy answer, I know, but it's a complicated issue. It's not one that is simple. This is the first global pandemic, as I've said before. There's no rule book on how to manage this crisis. However, I feel very confident that the people we have that are helping us manage this crisis are unbelievably knowledgeable, professional, well-informed, and they want to see this, have our community up and running as quickly as possible. And I don't know, I mean, I would say to either Bob or Dr. Bickle, if you'd like to add anything to that.
Dr. Bickle, please, if you got anything to add.
Well, just that this is a, evolving process, and we've actually been doing quite well locally in controlling this. The question is, when do you start transitioning to a more relaxed set of measures? And part of that has to be you have a process in place to control any spread in the future. And so when you have small numbers of patients getting this in a community, you can do contact tracing, quarantining, and almost like local epidemic control. When it gets spread through, more into the community, you can't do that. The system gets overwhelmed. So we're trying to get back to that stage, and there's a lot of discussion now about what to do at that point. And it's coming. It's just, the general idea is that you don't want to do this too soon. You want to virtually wipe out the spread in a community before you relax things. And that's probably on a state level, because it's too easy to spread locally, from one area to another. The number they've been talking about is when you get to, 10 or so cases in a state per day, that you can, that means most counties would have no cases each day. Then you can revert back to a more normal pattern of activity out in the community and just concentrate on your public health efforts to contain this and find little outbreaks and then snuff them out. So that's where we want to get, and hopefully, fairly soon. But you don't want to jump the gun, because if it slips and you start getting a second wave, then you have to do this whole restricted measures for several weeks to get it under control again, and that would be a major setback.
And Mayor, if I may, I think it's important to take each day at a time. We are still ascending the curve. We have not reached the top. The Institute for Health Metrics and Evaluation from the University of Washington is now telling us that for Florida, that date is more closer to the beginning of May, on May 2nd and 3rd. So we do have a ways to go yet. Let's take each day at a time.
Yes, thank you for that. So I'm going to, again, a lot of the questions surrounding what we just discussed and also the testing themselves, but this was a question that came in. Given the large number of nursing homes, assisted living facilities in Palm Coast, what action is being taken to ensure that they are adhering to the best practice guidelines and have sufficient staff with appropriate PPE?
I can take that, Mayor Holland. The most vulnerable population in our community is our elderly, and it's individuals who are in our nursing homes and long-term care facilities. So that was recognized from the very beginning by the governor and by the state surgeon general. There are guidelines from the time someone enters a nursing home, with the visitation policies that are now being adhered to, basically no visitors. There are guidelines by the CDC and Department of Health with respect to the residents on just careful monitoring, knowing what to look for by staff with respect to the clinical symptoms. If clinical symptoms appear, the guideline is please call the Department of Health nurses immediately so that we can see what aid and assistance is needed locally and at the state level. So close monitoring of residents and then very close monitoring of staff. Staff members need to be wearing masks at all times. Precautions are being adhered to by all nursing home, long-term care facility employees. And, if you're sick, everyone is being required to stay home. Temperatures are being checked and clinical symptoms are being watched for daily of these very important employees in our nursing homes. And we have someone in our health department that is in contact with each of them on a daily basis to make sure that there are no issues or concerns. So we're watching this population very, very carefully.
So Wally, I'm going to pose this question to you as it's hospital related. There's actually a few that came in regards to how the hospital's doing, but one of the questions, I'll do it twofold, and then we'll go to other speakers as well. So are you at capacity? And then the secondary question is, Advent Health Palm Coast Hospital has previously refused to confirm the number of inpatient cases being treated here. Is that correct? And if so, why is that?
Sure. I'm going to start by answering the second question first. I think that's a pretty easy question. I don't think that it's accurate to say that we were refusing to share that information. We were following the process that has been established, and it was established for good reasons throughout the leadership of our state. And so we're reporting all this information to the Florida Department of Health, following the process it's been in place. Now, to answer the first question, which it was, are we at capacity? That's a very good question. We have been aggressively planning since February for a possible surge. Now, we do have capacity to handle the expected surge, and we can expand our facility even further if we need to. We have done all of the analysis within our walls to see what we can do. But we can also rely on other Advent Health facilities across our region to support us if there is a need. And in turn, we also are offering our support if there's a need in our neighboring counties within our system.
That's great.
So our corporate office also has been helping us with the supply chain. They have been searching around the globe, and I did say around the globe, to make sure that they can purchase equipment and supplies since February, so we can distribute within our system, and that's been very helpful. We did reduce the number of patients in our facility by delaying the elective surgeries or non-emergent surgeries and procedures, and this helps us so we can have space, supplies, and then even personnel to care for the patients in case of a surge.
Thank you so much, Wally. This next one really has to do with testing, so I'm not going to pose this to Wally. I'm going to pose this actually to both Dr. Bickle and then Tony, because again, the testing is complex. I learned a tremendous amount in getting to know Tony and listening to the conversations to even be able to offer the testing at the rate in which we are today. When I said a lot went into this, there is only, my understanding, one of Tony's company is one of 41 that is a recognized COVID-19 testing, and they had to go through and get approvals through the Department of Health in the state of Florida to be recognized to be able to perform the testing locally, as well as Advent Health had to go through their policies and practices. So one of the questions that came in is, why are we not doing antibody testing to identify those that have recovered from the disease?
So from the Advent Health side, the good news is that we are actually able to provide antibody testing as of last week. Obviously, this needs to be with a physician order. So anybody that feels that they are a candidate for this type of testing, they can reach out to their physicians, primary physicians, and the physician would send us an order for that. This is important because as we see in the media, we heard a lot about the convalescent plasma treatment. This is an important step so we can identify donors that have the antibodies that could be part of this treatment, and by donating, they will be part of this. So, you know, if there are any converted patients here who at least 15 days ago, they experienced symptoms and they were positive and they're no longer have any of the symptoms, please reach out to One Blood and see if you're eligible to donate, because it will make a difference. And we're at Advent Health Palm Coast, we're able to provide those tests.
So Dr. Bickle, did you want to add anything specific to that?
Yeah, I think there's been some misplaced hope on the antibody testing and what it's going to be useful for. Initially, in the early days, I think the feeling was we might be experiencing 5, 10, 15% of the population getting infected. And if there was another, maybe 50% of patients that got this were asymptomatic, it might turn out instead of 5 or 15%, we'd have 10 or 30% and on our way to herd immunity, or just a lot of people would find out that they were immune and didn't have to worry about it anymore, could go back to work. That's really not panning out. I mean, we're looking at maybe 1% of the population in Florida would be infected or have had the infection. So it's really useful for healthcare workers, first because they have a much higher likelihood of getting infected. Secondly, because then once they've had it and they're immune, they don't have to worry about exposures. But for the general population, it's mainly going to be useful for surveillance to give us an idea how much did this spread in the community. And it's probably going to be a pretty tiny number. A lot of the experts are putting out figures like 1 or 2%. I mean, in Flagler County right now, we don't even have 0.1% of the population who's had this. So if you double that or triple it, say there were asymptomatic people that weren't diagnosed, or there were people who didn't meet the criteria for testing that had symptoms but weren't, immunocompromised, it might get it up to, 3, 4, 5 times that number. It still wouldn't even be 0.5%. So as these things evolve, it's looking like, at least now, that it's not going to be as useful, at least in this stage of this pandemic.
Yeah, and let's keep with that theme of the testing, because again, I want to take advantage of the fact that we do have experts on the call for our residents to understand the testing itself. What is the purpose of having tested for COVID-19? If you are tested today and the result turned out to be negative, while in fact the person that was tested negative can always become positive the following days. Isn't that a big waste? What protection will the masks offer if people don't know how to properly put them on? Improper disposals or used masks can actually spread the virus.
Steve, you and I have had a lot of discussions about this, so I'm going to let you take it, especially the part about the masks, if you don't mind.
Well, there are two types of tests, basically. There's a test for the virus or particles of the virus, and then there's a test for antibodies, which is your own immune system responding to an infection. The antibody test doesn't convert immediately because it takes your body, 5 days, maybe more, to develop measurable antibodies that'll show up on the test. So it's not useful in determining initial stage of infection. Why do we test? Well, we don't test right now because we've got a great treatment that we can put in place right away. So that's part of what's informed how we develop our strategies. We're mainly testing to isolate people who have this, or to identify people who are sick who have it, or are going to be hospitalized, so that containment measures can be put in place to keep them from spreading it to others. And then the point about, can you be tested 1 week and negative and then positive the next week? Sure, because you could be in the early stages where the virus is barely detectable, or you could just get an infection, 1 week or the next week. So the testing only tells you at one point in time, do you have virus in your system? And it's only really useful basically to find out how many people are infected in an area, to quarantine them and to, make sure they don't spread it to others. And also as a general thing to affect how aggressively these people are managed in hospital settings.
If I may, before we talk about masks, is the main reason for testing, and it's a very big public health endeavor right now, and also by the hospitals and urgent care centers and others, is we do want to know who is infected so that we can then do contact tracing and identify the very, very close contacts, prolonged contacts of those individuals who were infected. And that takes a lot of investigatory work, a lot of epidemiology activity going on, and that is very important to reduce the transmission of the virus in the community.
Yes, and did you want to add to the masks?
Yeah, so masks, yeah, Steve and I have talked a lot about this, as have others. We are, encouraging the practice of wearing masks, especially when you're out and about in the community. Whether it's going to a grocery store, whether it's running an errand, whether it's being in the midst of other people. I think the mask decision changed when we saw that there is potential for a lot of people who are asymptomatic to the virus. So I think that's what really encouraged the mask wearing over the last couple of weeks. Steve, any further comment about the mask wearing?
No, that's basically it. I mean, the two categories where it's really felt to be useful are, one, healthcare workers and people have close contact, like somebody in your household, where you want every bit of protection you can get from, it's so highly likely that it can spread to you. And the second one is for these, asymptomatic, contagious people in the community, don't know they have it, but have virus in their system and could give it to others. So they wear the mask to keep from expelling the virus that other people would pick up.
Yeah, and to that point, Tony, if you're obviously have contracts and doing work all over the country, your company is. Can you speak to, again, how you get listed as a recognized testing laboratory, what goes into that, and as far as your quick turnaround, why that's so important, again, because you had mentioned on our initial introductory call how the quick turnaround also helps with the PPE equipment that is a tremendous shortage throughout the country.
Yeah, so the first part of that is the process to get recognized. We are listed on the FDA's website as a validated assay. We are an independent laboratory. We're not buying kits from other large manufacturers. This is a test we developed in-house because our primary business is RT-PCR for pathogens. And so we had a unique ability to pivot our current business model into, and really a responsibility as far as we're concerned, into COVID-19 testing. So we've been through the process with the FDA to have our assay reviewed and validated and put on their website so that institutions can find us. So we do testing for a number of hospital systems in about 7 states and a number of counties. And we do limit, as you mentioned, we limit the number of contracts we get into because there is fluctuations in volume from each of these contracts as outbreaks occur. We have a lot of business in New Jersey and in Georgia, and as there's outbreaks, you get increased volume. So we don't fill our full capacity on purpose so that we can get this turnaround time. The early feedback we received from some of these hospital systems was that our turnaround time allowed them to move patients in and out of their facilities appropriately, and thereby saving PPE, because a patient in one quarantine room might require anywhere from 3 to 8 changes of PPE just to manage the patient daily. And that's very costly and it's hard to come by. So early on, we made this decision that we would, part of the process is not to get as many tests in the door as you can. It's to help your accounts manage this disease within their facility. So, and that's why we choose to take our time with contracting and selecting who we work with purposefully.
That's great. Thank you.
And Tony, when Mayor Holland introduced you to us, Wally from the hospital and us from the health department and Jonathan from county management, we jumped right on getting Tony and his company approved by the Department of Health. And we also had Dr. Bickle speak to him on the phone. And when Dr. Bickle hung up, he called me back and he said, Bob, this is a state-of-the-art, first-rate laboratory. And we're so lucky to have Tony in our community. So, Tony, thank you so much. We're glad you're part of the team.
Yep, glad we could help.
Agree. And at Advent Health, we just received the first shipment from Tony's company yesterday, and we're getting ready to also partner with Tony and make a difference here in our community. We will be using those test kits with our drive-through as well, so we can help out and have more people tested throughout our community.
That's fantastic, and again, that makes that difference when you're speaking about the volume and how we can advance this and hopefully get through this sooner rather than later. I'm going to pose.
Mayor Melissa, can I just add in here, and I want to thank you for your leadership, because the connection with Tony and his company was made through you and your team, and we really appreciate that. And it was a little week ago, and now we're here already having conversations on how it's going to be used. So thank you for your leadership on that.
We appreciate all of our stakeholders and community support. So Matt Morton, I'm going to pose this question to you. What, if any, monies has the city received in response to COVID-19? Why are all the other fees attached to the water bill? That's sort of outside the scope of COVID-19. And just if you can speak to what we've done as a city with the fees and everything else.
Certainly. So to date, we've received no monies for the response to COVID-19. In fact, we are, working with our connections with our lobbyists and our stakeholders, because small to medium cities right now, by and large, are being left out of the federal stimulus to cities. We continue to track this as an active disaster, which it is. We continue to do our FEMA forms and our 214s, and it's very technical, but what that is our reimbursement potential for monies expended in relationship to this crisis. That's hours worked by staff. That's equipment purchase, like the what they call autoclaves, those sterilizers we bought very early on to sterilize rooms, or whether it's hand sanitizer, or just things again that help us manage our community and manage our workforce and the day-to-day business of the city. As far as what we've done so far with the water fees and charges, I think what we're discussing is, again, very early on, Mayor took the lead, and we've suspended our shutoffs and disconnections, knowing that water and sewer are essential for people who are home and need sanitation and need clean drinking water. In addition to that, we've suspended any and all late fees through this crisis on our water and sewer bills. So with that, we continue to robustly monitor the utilities. In fact, yesterday council made a decision, and these decisions are more magnified and more viewed in times of crisis, but upgrading an essential generator that powers clean drinking water pumps. And so we continue to invest and keep our utilities in tip-top shape, understanding that's an essential service to our community. We continue to do the best we can in meeting our community halfway during this time of crisis with our billing, and we continue to have 100% efficiency and reporting of staff to our water and city utilities for operations. We have seen no lag in service and no lapse in maintenance, so very, very pleased that those things are staying robust and staying in very good condition.
And I think that's important to note. When you think of the disruption in services, again, this is an unprecedented time. So we were able to pivot rather quickly to a virtual city hall without disruption on services. And I know, Matt, you've done a lot of forecasting and modeling with our chief financial officer, Helena. You're having constant conversations. We will see an impact because of this. We will see an economic impact because of this. We're asking people to stay home to mitigate the spread of this horrendous virus. Well, that does to city budgets. There's an impact there. That's less gas tax collected. That is less sales tax collected when restaurants are asked to close down and again minimize the spread of this virus. So we are having conversations on a regular basis with the council as far as what this overall impact is going to mean to the city budget, and as far as providing those essential services and what that's going to mean to the taxpayer. We have to balance that with the fact that we have an unemployment issue, and that's why we're grateful. If you think of a hospital system that continually keeps those employed, that's tremendous. Or our school district that has teachers teaching virtually and continuing to employ the largest public sector employment in our community. That is helpful through these very challenging times. That does make a difference. However, we do understand that those Small businesses, we are doing everything in our power to help get them relief throughout this process. And I'm hopeful that Congressman Waltz even said it this morning on the radio that you know, those monies can be expected. They're sort of hit or miss. I know he's working a lot to ensure that the businesses can hopefully take advantage during this trying time. So with that, I would say, please continue to support your business community. Again, practice social distancing. Please stay at home as much as possible. But if each one of us can go out and do a takeout or pickup or a delivery service once a week, that has a material impact in a positive way for those businesses that are desperately trying to stay open through this time period. So I'm going to move again to some different questions. I'm going to go back a little bit about parks and trails, and we've closed them. We know, again, that's not something our residents necessarily wanted to hear, but it was essential. So if you can speak, Bob, to the reasoning again, when you talk about beaches, we get a lot of questions about beaches. There's no doubt about it. You know, our residents love the beaches, the trails, the walkways, the paths, the parks. They will be open again, but we are absolutely 100% heeding the advice of the healthcare professionals.
Yeah. I'm among those residents who absolutely love the beach and love to recreate there, go for a walk, go for a swim, whatever. But these are, again, are unprecedented times. The last time this happened was 102 years ago with the Spanish flu in 1918. So we just need to continue to practice this form of social distancing till we see, like Dr. Bickle mentioned, that the threat has passed, that this wave is over, and that we're seeing, 0 cases here in Flagler County. And together as a community, we're making these decisions for what's in the best interest of the common good for all of us. It's this debate of individual rights and liberties versus what's in the best health and safety of all Flagler County residents. So it is tough, but we just got to hang in there. Before we closed the beaches, we just saw too much evidence, everyone, of gatherings, people that were just close contact within 6 feet, more than groups of 10, and there were pockets of this on the beach. So I really think that we did the right thing to make sure that this virus doesn't spread, and this was just one of the mitigation measures that ended up being, I think, very important. So hang in there, everyone.
Yes.
Hang in there.
And Dr. Bickle, if you could speak to the severity of this virus, I think that's important because I get questions a lot as well, just from our residents, what's the difference between the flu and this, and, why these extreme measures were taken. Help us understand that. Is he still on?
I didn't quite understand the question.
Yeah, Dr. Bickle, Mayor asked, the difference between the flu and this virus. I mean, you've described the coronavirus as being extremely contagious and just a great threat. Can you just expound on that a little bit more?
Yeah, basically there are two things that are really bad for a virus for humans. One is, does it spread easily? And the other is, does it cause serious illness? And this one does both. That's why it's so bad. That's the basic answer.
No, I think that's important to note, again, because decisions were made, and unfortunately, our residents were impacted by those decisions, but these were life-saving measures that we had to take in order to keep our residents as safe as possible. And unfortunately, there have been losses, and we never want to see that in a community. That impacts us greatly as community leaders, yes. and that stays with us.
Steve, I think our scientists, researchers are saying that this virus is 10 times more contagious than the flu. Is that your recollection as also?
10 times more fatal, is that what you're saying?
No, contagious than the flu.
Oh, not necessarily 10, at least double. But double's bad because it's exponential growth. So, like when you get it's quite a bit more contagious. Let's just put it that way. The other thing I think people need to keep in mind is that where do we want to get with all this? Is basically we want to get to a state that we were in January, where there was no COVID here. And if it was coming in, we would have the resources with tests, personnel, knowledge in terms of strategies for testing, that we could let the community go on about its business, which South Korea more or less did, and continue an extremely aggressive surveillance, testing, and case containment program, so that every time we found a case, we, kept it under control and it never spread into the general community, and then people could go out on about their business. But to get there, we have to get back to such a low number of cases that strategy would be effective. And that's, people keep asking, when are we gonna switch over and all that? That's where we need to be, basically, so that we could go back to that other strategy and then contain this without all these societal restrictions.
That's a great answer. Thank you for that. Wally, our residents want to know, what is the status of the local ER and how are the nurses, doctors, and healthcare personnel doing?
Sure. Our local ER is working fine. As you know, we do have capacity, as mentioned earlier. The information that I think I want to take the opportunity to share with our community is that not necessarily here in Flagler County, but in other areas, we have heard reports that people who had, for example, heart attacks, so they had other issues, but they were afraid of coming to the emergency room in fear of contracting COVID-19. So patients we just want to reassure the community that once we're screening everybody outside, and once we have somebody that the screening is positive, meaning we're going to test that patient, we're going to treat it as a possible COVID-19 patient, there is a process where we can bring that patient in through different areas, put them on negative pressure rooms, and make sure that they are away from everybody else, and the staff there is already trained to take care of that patient. Obviously, we're not allowing any visitors to go in, so the only people actually that are going into our emergency room waiting area are patients that are not screened positive for COVID-19. So that answers the question about our local ER, and we want to make sure that our community knows that we're ready to treat any type of patients that will come in. Now, how our nurses and doctors are doing, that's a very good question and a popular question. And I'm happy to report that we are doing well. Everybody's doing well. Obviously, the stay-at-home initiatives here in Flagler County is paying off, and we can see that throughout the day. Our employees, not only nurses and physicians, but also our environmental services, facilities, food services, all of our staff, in some way or form, they do come and they do have kind of a frontline exposure to all of our patients as well. So we got to keep all of them in mind. We got a lot of questions about protective equipment as it relates to our employee, and today our teams have the appropriate level of masks, protective gear based on their role and their level of direct care. One of the things that we also did to make sure that our staff is doing well emotionally and financially, we have made a commitment to some of the patients, some of the employees to work from home. So we have a number of employees working from home so they can stay away. The pay continuation continues. We made a promise and a commitment to our staff to pay them regardless if their job is still here or not, if we're seeing patients on their department or not. We're providing child care assistance to our staff as well in case they're having difficulties with that. And this is an opportunity for me to send a shout out to our local hotels here also in Flagler County. I worked with 6 of them, and all of them are willing to give a very significant discount to healthcare workers in case we have healthcare workers here that prefers not to go home, just in case they feel that they might have been exposed or not, or for peace of mind to keep their family protected. So we want to thank all of the hotels around here that are willing to work with us. So overall, the staff is doing well, and we appreciate how the community has responded so far.
Thank you so much. And we are out of time. I do want to thank our special guests for calling in today. I think your answers and your information is invaluable for our residents to hear. All of the residents' questions will be answered. And you can view all the questions asked, all the questions answered on our Palm Coast Connect page, our Facebook page as well. I would encourage everyone to continue to stay informed, stay at home, stay safe, and now please make sure you're checking out the Rise Up Palm Coast initiative in an effort to really see all of the great opportunities we have right here in our hometown, right in our own community, in the safety and comfort of your own home. And so please let us know if there's anything else you'd like to see as far as that. But make sure that, you know, again, you're checking it out and supporting those organizations that have helped us out to create a robust, we call it mini television programming that you can watch at any given hour and any given day. So thank you for continuing to sign up. Thank you for continuing to be a great community member and heeding the advice. Thank you, Bob Snyder. Thank you, Matt Morton. And please make sure you sign up for next week's virtual town hall.